Bone marrow cancer. What to know? Bone marrow is a soft, spongy tissue that is in the center of most bones. Several types of cancer, including multiple myeloma, leukemia, and lymphoma, can develop in the bone marrow. Bone marrow contains stem cells that develop into various types of blood cell, including red blood cells, which carry oxygen and carbon dioxide throughout the body, white blood cells, which fight infection, platelets, which help with blood clotting. The body usually produces these blood cells then it needs them, such as when old blood cells die. Bone marrow cancer develops when these cells replicate too quickly. Symptoms. The symptoms that a person experiences will depend on various factors, including the type of cancer, how aggressive it is, and its location in the body. Symptoms of multiple myeloma may include bone pain or fractures, fatigue, increased rate of infections, changes in urination frequency, confusion, thirst, nausea or vomiting, unexplained weight loss. Symptoms of leukemia may include weakness, fatigue, shortness of breath, fever, bone pain, unexplained weight loss, night sweats, enlarged lymph nodes, a swollen spleen, frequent infections, pale complexion, frequent and unexplained bruising, prolonged bleeding from small wounds, body aches. The symptoms of lymphoma are similar to those of leukemia, but they might also include the following: a persistent cough, itchy skin, lymph node pain after consuming alcohol, loss of appetite, abdominal pain, itchy skin, rashes or skin lumps, feeling full or bloated due to an enlarged spleen. Anyone experiencing these symptoms should see a doctor without delay. Types. Doctors categorize bone marrow cancer according to the type of cell that it affects. Multiple myeloma. Multiple myeloma is a type of cancer that occurs in the plasma cells which form in the bone marrow. Plasma cells play an important role in the immune system and make the antibodies that the body needs to fight foreign bacteria. Leukemia. Leukemias are cancers of the white blood cells. Sometimes these types of cancer start in other types of blood cell and then spread or metastasize into the bone marrow. Acute leukemias are fast growing cancers while chronic leukemias grow slowly. There are several different types of leukemia, including acute lymphocytic leukemia or ALL. This type of leukemia is more common in children than in adults. Acute myeloid leukemia AML. AML is most common in older adults, although children may also develop it. Chronic lymphocytic leukemia or CLL. This slow-growing leukemia originates in the lymphocytes, a type of white blood cell, and it is more common in older adults. Chronic myeloid leukemia CML. CML is rare. It starts in the bone marrow and spreads to the blood and other body tissues. Chronic myelomonocytic leukemia or CMML. This type of leukemia grows in the bone marrow cells that produce other blood cells. It primarily affects older adults. Lymphoma. In people with lymphoma, cancer develops in the lymphocytes, which circulate in the blood and lymph tissue after their production in the bone marrow. Lymphoma can occur in many places in the body, including the bone marrow. There are two main types of lymphoma. Non-Hodgkin lymphoma. This type of lymphoma can develop anywhere in the body and it affects many different types of lymphocyte. Hodgkin lymphoma. Hodgkin lymphoma is also a type of cancer that affects lymphocytes. It is distinct from non-Hodgkin lymphoma due to the presence of a specific type of abnormal cell called a Reed-Sternberg cell. The outlook for people with bone marrow cancer varies significantly among individuals. If a person receives a diagnosis before the cancer spreads, they are more likely to respond well to treatment and remain free of cancer for years after going into remission. In other people, bone marrow cancer is aggressive. Treatment may not be as effective for these people. Additionally, both cancer and its treatments can cause life-threatening complications such as severe infection or kidney failure. A person should talk to their medical team about the different treatment options available.